Go.
We're here today to present a proposal to you about our intervention that we've been working on in regards to suicidal youth and mental health within the youth in the state of Kentucky, specifically Fayette County.
Our macro population for this project is teenagers ages 12 to 17 in Lexington, Kentucky. The problem with this population is the risk for suicide and lack of mental health services within the school system. A fact about the risk of suicide in Kentucky is suicide is the 11th leading cause of death overall and the second leading cause of death for ages 15 to 24.
So the first step to our intervention is to engage our clients, and to engage our clients we chose two schools within the Fayette County district, a middle school and a high school to cover our age range. And we're going to begin this process just to get the kids, get their input, get the kids excited for this. We're going to start with some sort of incentive program. While the source of our intervention with the mental health professional and the questionnaire that we'll get to in our proposal will be confidential, the participants' voices will be heard within the entire intervention simply by their willingness to participate. And to gain cultural awareness for the youth in these school settings, it is important that mainly the mental health professional, but also we as researchers, go and just talk to these students in a casual setting. So once we and the mental health professional establish the incentive program, then we'll just chat with the students that express interest towards honestly just talking to us, and we'll get sort of an idea of their worries and the stresses just in casual conversation. So, the main vision for our program is to decrease suicide rates in teens by improving mental health services in school settings. And our mission statement is to increase awareness of the risk of suicides for teenagers by improving mental health services in the school system.
Our intervention would first need a policy change to add more mental health services within the school systems. I'm just going to touch base on this quickly because without a policy change, then we won't be able to have our intervention because we're going to need a mental health service provider within the school. After this policy is in place, the mental health specialist will be provided funding to start the program. So we'll give the mental health specialist funding to start the program and have programming for the students. These programs will include the importance of mental health, risk for suicide, preventative measures, and what to do if you need help. The investment and participation. When building support, it's important to not only get the teenagers involved, but their parents and guardians as well. To spread awareness about the policy change, we'll send out forms telling parents that we need this policy change, this is what you can do, this is the risk of suicides in teens, and while providing the statistics, it'll give us more support in getting the change so we'll get mental health professionals within the school systems. Participation and impact within students. After we get the policy implemented, then the mental health specialist can encourage participation with support groups and after-school programs. By having the students fill out a questionnaire at the beginning of the program, it'll give us an idea of what the mental health specialist needs to do within the school, whether it be support groups, after-school programs, if they're depressed, if they have anxiety, if they're feeling suicidal, things of that nature. The impact we hope to have on this policy change in the health program is the decrease in suicide within the teen population. We also hope to impact the mental health overall for students while also breaking the stigma. It's important to break the stigma because if we don't break the stigma, then the students won't take this issue seriously and they won't hone in with their inner emotions and what they're actually feeling. Here's our logic model. The program investments would be schools, policy, lawmakers, community members, students, funding, staff, and materials. Some activities we would do would be support groups for the students with, if a bunch of students had anxiety, then we'd have an anxiety support group, and educational resources when help is needed, and after-school programs. Participation will be that students will attend the support groups for mental health issues that they may be struggling with. Short-term goal would be students learn risk factors of suicide, and they'll learn resources they have access for getting help that they need. A medium-term goal is students change their mind about stigma and mental health, and they'll enjoy their support groups and the help that they get from one another. And lastly, our long-term goals, the risk of suicide in teenagers will decrease. Strengths and challenges of macroclimates. Some strengths that the students will have is their independence because they're coming into their teenage years, they're wanting to be more independent, they have that drive for change and being their own person and not who their parents want them to be, and their social strength of having their peers for them. Some challenges they may face is lack of seriousness because when you go through puberty, you don't take things as seriously, and if that kid's making fun of mental health, then you won't feel as comfortable to cope with your own mental health needs, and the unwillingness to participate because of the stigma. Leadership, staffing, and key members of the community would be the mental health professionals in the school system, and the parents would be who would help in the community. Some potential results. A positive result would be decrease in suicide rates among teens, while a negative result would be students will not utilize mental health professional and they'll just not take the professional seriously, and it would just not be good.
Looking at our finances, our main expense would be hiring our mental health professional. So we would need to pay for their salary. And then other costs would be marketing associated costs, general office supplies, and different program specific costs. Our income, it would be the grant that we are applying for. It's called Project Aware, Advancing Wellness and Resiliency in Education. And it is sponsored by the Substance Abuse and Mental Health Services Administration Center for Mental Health Services. So this program, this grant, would give, the purpose of it is to increase awareness of mental health issues among school-age youth, provide training for school personnel and other adults who interact with school-age youth to detect and respond to mental health issues, and connects school-age youth who may have behavioral health issues and their families to the services that they need. So the anticipated grant amount would be $1,800,000 per year, up to 5 years, and the application due date would be on December 24th. Furthermore, this grant supports the development and implementation of a comprehensive plan of activities, services, and strategies to decrease youth violence and support the healthy development of school-age youth. This also builds upon the Safe Schools and Healthy Students initiative. So this grant went hand in hand really well with our intervention.
So post-intervention, we as well as the mental health professional will conduct an evaluation. So for our evaluation, we chose one short-term goal, one medium-term goal, and one long-term goal. And the short-term goal was students will learn risk factors of suicide. The medium-term goal was students will enjoy their support groups and the help that they give one another. And the long-term goal is that the risk of suicide would be lowered. So those first two, short and medium-term goals, will be measured by a post-intervention survey questionnaire that would be distributed to the participants by our mental health professional. If the majority of students respond to that questionnaire saying that they feel more educated on the risk factors and that they do enjoy the support groups and feeling supported by their peers, then we will deem the project successful. The long-term goal will be evaluated by us as researchers, and we will measure that 5 years post-intervention when the grant has ran out. So we will collect data from that current time, and we will collect data from when we began the program 5 years prior. And if the rates of suicide had proved to decrease within that time period, then we will deem the project successful. So meeting objectives. So because we are providing funding for mental health professional, that individual will be responsible for the initial evaluation of the short and medium term goals. And she will conduct those questionnaires that will be given to us for us to collect the data within them. To effectively measure our success, we as researchers will evaluate the long-term goal. In the evaluation process, our objectives are very similar to the goals that we set. We're striving to improve mental health as well as decrease suicide ideation within youth, and these objectives will prove effective as the programs are deemed successful. And in terms of financial evaluation, we will compare the grant money that we were given to the expenses that we saw were in place during those 5 years the mental health professional was there, and see if our finances were able to line up. Impacted improvements. The macro climate, which is teens in Kentucky, has the potential to be impacted by social contagion. So we know as a modern society that teens have the tendency to reach out to more people than those that are just very nearby. They can reach out beyond Kentucky, beyond the United States. So if our program is deemed successful and those individuals, specifically in Fayette County, feel like they are positively impacted by our programs, then that will spread and become viral. And in order to improve the future programming conducted by our mental health professional, the data that we collect, we will provide to that individual so that he or she can see which programs worked and which programs didn't.
Right, and so in conclusion, we have realized that suicide rates are higher in youth than ever before, and we need to put a stop to it now. Through our intervention, through the programs, through the mental health professional that we will hire, we will create a social contagion, as Michaela said, and the overall experience, the high school and middle school experience for these children will be impacted by the programming, and so we appreciate you listening. Thank you.